welcome to our webinar, Concussion Rehab 101, Where Do We Start? I'm going to go over a few opening items, introduce our presenter, and then we'll get started. If you're watching this live and you have any questions, feel free to drop them in the questions box at the bottom, and we'll have a few minutes for Q&A at the end. Our speaker today is Nathan Diffenbaugh, Outpatient Rehabilitation Manager at Lehigh Valley Health Network. He received his bachelor's in health science and master's of science in physical therapy from College Misericordia, completed his doctorate of physical therapy at Misericordia University, and completed his APTA vestibular competency course in APTA's credentialed clinical instructor program. Nate became an impact-trained physical therapist in 2017 and serves as part of a multidisciplinary team that supports the LVHN concussion and head trauma program. He specializes in concussion treatment from accidents to professional athletes and has contributed to CE opportunities provided in areas of vestibular and post-concussion rehab. Thank you so much for being with us today, Nate. I'll hand it over to you to get started.
All right, thank you very much. So today we're going to just kind of go over a little bit about what you need to think about if you're looking at setting up a concussion rehab program in your clinic. First, let's just look at some basic numbers. So as of the current time, the CDC is reporting that almost 500,000 children are treated in emergency departments across the country each year for head injuries. Kind of surprisingly, 50% of those injuries are due to falls. So, a lot of times we think of sports as causing the injuries, but really kids are as clumsy as the rest of us and can lose their balance, fall, and hit their head. Also kind of interesting, this is going back a little bit, so a little bit older data, but rates of visits to emergency departments more than doubled between 2012 and looking back at 2001. And there's many reasons this could be happening. People may be getting injured more. Is there more awareness? Are people seeking out care sooner than later? Or even is it just something where doctors are now routing patients to the ED to be seen versus assessing them in the office? Those are some open-ended questions that we really don't have the answer to, but we do know that concussion, the number of injuries that are recorded, keeps growing, and that does not take into account non-reported injuries. Also, similar to children, and this is across all ages, the top 3 causes of head injuries are falls, being struck by an object, and motor vehicle accidents. So realistically speaking, sports don't even fall into there. Which I think is important because usually when we think of rehab injuries and we think of concussion, we think of sports. And people may say, well, my clinic's not exactly set up for sports, or I'm not a sports-based therapist. You don't have to be. These individuals can be injured in all types of manners and basically span the spectrum of ages from pediatrics all the way up to geriatrics. Sort of as we alluded to, there is definitely an increased awareness of concussion in our country at this time. Certainly just watching news reports, you can see information about, studies involving injuries and studies on how should we treat patients and all that kind of awareness, and books and movies, and, it goes the whole spectrum. Professional sports themselves have sort of brought concussion awareness to the forefront. Sports like hockey and football especially have upped their program on how they, interact with their athletes when they're injured. We see athletes being removed from games more frequently when they suspect a head injury. That removal may be for the whole game versus before where it might be check out on the sideline, you look pretty good, let's go back into the game. Now they're looking and saying, we're going to stay out this game, we're going to check you out, and we're going to make sure you're good to go come the next game. Also, the NFL has introduced independent spotters. So individuals on the sidelines or up in the press box who are not related to either team are watching the athletes, are watching the hits they take, and if they see some questionable movements or somebody not acting funny, they can flag down to the sideline saying, hey, get this player out. We want them assessed for a concussion. You just need to watch any NFL game and you're probably going to see someone pulled. So definitely has increased awareness. Parent awareness for our pediatric population, our teenagers. Um, Parents are definitely more aware of these injuries. Schools are offering information sessions to parents about the injuries, about treatment. Schools are setting up programs of how to monitor these students that are attending. How do we get them back to their schoolwork? What do we do if someone is suspected of an injury? Um, and this is not just, once again, in their sporting programs. This is, gym class, or a child falls, or a child hits their head on their locker. Um, Nurses are aware of what to look for, and, frequently will call parents and say, hey, you need to get your kid, get them checked out, and then let us know what they say. Um, Also, most coaches have mandated training, and this is not just professional, college level, high school level. A lot of youth sports programs are mandating that their coaches go through training, how to spot an injury, what to do if a player is injured. Because let's face it, coaches a lot of times are volunteers, especially in youth sports. They're not, ready to make a judgment call on someone's health condition. These courses kind of educate the coach what to watch for in practice, what to watch for in a game, so that if they see someone get injured, or if they notice that one of their players doesn't look right or seems to be acting a little bit unusual, what do they need to do? Um, Making sure they're getting the kid out of the game, making sure they're getting the parents notified, making sure they're getting the kid to where they need to be to assess, do they have a concussion or not? Also, many states have introduced something called a Safe Youth and Sports Act, or another type of law along that line. Um, these laws basically mandate how a child, so someone that is intermediate school, high school, who is injured in a sporting event, how they are monitored, how they are assessed, and what needs to happen before they are allowed to return to the field of play. Usually, it's some type of check box system where they need to see a certain provider, pass a certain test, or be cleared to play by a certain medical professional. And those can vary a little bit by state. So it's always kind of good to look at your state to figure out what those laws are. So, with that being said, what is the role of a rehab professional in helping someone recover from a concussion? Well, just from the basics, our job is to help someone return to their functional independence, maintain that activity level they were at before, get back to doing what they want to do typically. Um, one of the things that we first do when we see patients is we help with their symptom management. So, how are we, how are we addressing their symptoms? What are their symptoms? How are we monitoring them? Um, we also have to assess and treat their functional deficits, um, looking at things such as what can they do safely, what can they not do safely, and what do you need to do in your normal life. This can be balance, it can be cognition, it can be um, anything. We need to make sure that they are safe to return to their daily activities. So if someone is unable to maintain their balance at a previous level, that is definitely a safety concern. If someone is maybe a little delayed in their reaction time or their cognition, um, that can have, very significant deficits on their safety at work, on their safety at school, on their safety in the community. Um, we need to then also look at what are their normal routines. So if it's a student, what do we need to do to get them back to school? Um, what do we need to do first to get them into school, and then to do their normal activities and to participate in their classes and do their schoolwork? For an adult, what do we need to do to get them back to their job? What are their job duties? And this, once again, can be cognitive tasks. It can be physical tasks. Um, Sports, whether it's someone that's a weekend warrior, a youth, or even a professional athlete. Um, Sports can take a big role in a lot of people's lives. And certainly, we don't want someone going back onto the field of play if they're not fully recovered. So, some of that is looking at just how do we monitor their activity level? How do we assess them to make sure they're safe to go back to play? Are they going to tolerate running? Are they going to tolerate jumping? Are they going to be able to make quick movements? Can they do it safely? Can they do it without having symptoms? And really, all of this ties in just to return to life. Um, if you have a headache every day, if you're dizzy every day, if you feel off balance, if you can't focus your eyes, um, if you're feeling depressed, if you just feel run down, you're not going to be able to keep up with your normal activities, your normal life, and that's huge. You know, concussions sometimes are kind of like that invisible injury where you can't see the injury like you would for someone who maybe broke their leg or injured their shoulder or had a surgery. Um, but with all those symptoms that can evolve with the concussion, it can be a significant detriment to normal activities. And patients will often complain, "I just want to get back to my life. I can't do what I typically want to do," and people don't understand. That's our job as rehab professionals, is to get them back to their normal life and let them do what they want to do. So, with that being said, who's involved in getting these individuals back to their life? Well, every clinic or facility may differ. So, for example, if you work for a large health network, you may have multiple providers included in your team. If you work at a private practice clinic, it may be you. It may be you and another provider. Um, so it is going truly to vary based upon where you work. Now, with that being said, a lot of times there's going to be a multidisciplinary team taking care of this patient. Um, it all starts usually with a physician, nurse practitioner, physician assistant. They can be a sports minded provider. They may be someone with some neurological background. It could even be a family doctor. Typically, what we recommend is that it's someone that has done some continuing education on specializing concussion management. Um, if this is someone and you work in a large health network, you want to make sure you're tied in with them. If you're at a private practice, maybe touch base with them. Work on setting up a communication chain so that you guys can go back and forth with each other to help these patients get better, and touch base as you notice things going on that maybe need more attention. That physician, nurse practitioner, PA, they're kind of a gatekeeper, or they're kind of the person that's going to order the different therapies required for the patient, and sort of direct that patient where they need to go to get the proper care to get them better. Certainly, us as rehab professionals, physical therapists, occupational therapists, speech therapists are all involved in their care. Um, and every patient's different. Some patients may see one of those rehab providers, some may see two, some may end up seeing all three. Um, but it's kind of important to just know all those individuals can be involved. A neuro-optometrist, neuro-ophthalmologist may be involved, especially in our patients who are having a lot of ocular motor issues or visual issues. They can take a very close look at what's going on with the patient's eyes, determine if things such as prisms may be required, and they can also order vision therapy. So sometimes a vision therapist is involved in this patient care as well. And certainly some type of counselor, mental health professional, or even neuropsych may be involved in the patient's care. Um, you think about a concussion, you think, okay, maybe my balance is off a little bit, or my eyes aren't doing as well, or I'm a little slow in thinking. We also need to remember our brain also processes our emotions and our feelings and manages stress. Um, if you're having a hard time keeping your balance, chances are your brain's probably not managing your stress level real well either. Also, remember, if you're having those physical problems, it's going to take a mental toll on you. Or, depending on how that injury occurred, there may be some PTSD, there could be some anxiety, um, definitely depression if it's someone that's very active and they feel like they can't go through their normal routines or play sports. We see that a lot. And this can be, once again, all ages. Look for it in your pediatric population, especially if they're not back to school. Kids by nature are social beings. They like to be with their friends. So all of those providers may be involved at some point of the process or for the entire process. If you're, in a smaller private practice clinic, and maybe it's just physical therapy and occupational therapy there, or PT, OT, and speech, um, reach out to your community resources, touch base with some of these other providers, um, you know, just get that chain of communication open. With that being said, the team approach is really what works best with these patients. Um, they have a lot going on. And certainly we need to address all of those factors. And once again, when you start looking at PT, OT, speech especially, a lot of times some of the care we provide may overlap a little bit. For example, OT sometimes will work with some cognitive things with patients, and certainly speech does as well. PT will work with patients from the vestibular standpoint, some oculomotor standpoints, but that's also something that OT can address as well. Um, so when you're starting to think about having a program, you want to kind of look at who you have on your team, um, and sort of start defining what role each member of that team is going to have. So if PT is working on balance and some oculomotor stuff and getting them back to play, well, then maybe OT is working on some cognitive tasks and some daily planning stuff and working on some more oculomotor stuff that PT is not addressing. If you have the luxury of having speech, well, now maybe speech is taking a bigger part of that cognitive tasks, or they're looking at more of their higher level cognitive tasks of what do they need to do to return to work. Or maybe OT is doing that. You know, there's not necessarily the perfect or most correct role for each person. It's what's going to work for your clinic. Um, and then one of the other things is to make sure you have that frequent communication. Talk amongst each other. You know, it's going to help with that, making sure you're filling the roles that you need to fill. It's also going to allow you to discuss how that patient's progressing or if they're not progressing. Um, Both are vital. You know, if a patient's progressing in OT and they're starting to do more of a certain type of tasks, and now that's something that you can include in your PT treatment, it's good to know. Likewise, if they sort of have plateaued in one line of therapy or in multiple lines of therapy, it's also good to have that discussion, figure out what's going on. Are we missing something? Do we need to have them go back to see their doctor? Are they having depression or things like that that's interfering with their ability to recover? You know, that communication really is going to help your patients get better quicker and just make them more satisfied with the care. Um, and, you know, as I already said, incorporating the recommendations from other disciplines into care. You know, if your colleague's noticing something that maybe you can help address, it makes your job that much easier, but it also gets the patient better quicker. And patients like that. Patients want us to focus on them as a team and not just go, well, I have PT, then I have OT. Um, and then, you know, just keep monitoring those symptoms. Watch for changes in their symptoms or complaints as the patient progress. If initially they were complaining of having a huge headache, and now you have some of the things calm down and that headache's starting to go away and they're not feeling quite as bad, well, maybe they're starting to notice that they're having more problems with their memory. And we need to sort of change gears a little bit and focus on that area. Kind of all of this, as I've alluded to, is that whole patient focus. Um, we have to realize that, you know, there's variations in how a concussion can present. Some people may complain of a lot of headache. Some people may complain of a lot of dizziness. Some people may not have any of that, and they complain of some memory stuff. But we also need to realize that in addition to those variations that occur of how that concussion may present itself, there may be a lot of other injuries that go along. For example, if it's a motor vehicle accident or someone falls down a flight of steps, um, what's going on with the rest of their body? Are they having neck pain? Are they having problems with their shoulder? Are they having problems with their ankle that's maybe impacting their balance as well? Um, all of that stuff can kind of play a role in how you develop your plan of care and also how that person evolves throughout their care. Um, we have to make sure, you know, we're focusing on both reported or subjective symptoms along with functional measures. Um, you know, there's things that we can test, and we can test balance. We can test how fast eyes are moving. We can test how quickly they can read or how quickly they can do certain tasks. But we also need to listen to what the patient's saying. Oh, I'm getting a headache. Oh, it's making me nauseous. Oh, it's making me dizzy. That's important to know as well. Um, it's that pain, like we always ask on our patients who have other injuries. How's your pain? Well, we need to always focus on that, or at least, you know, make sure we're tracking that as they recover. Um, and with these patients, it's huge to encourage them to complete their home exercise program. Um, I know that's important for all rehab, but especially with these patients, when we're addressing a lot of those simple or what we would think are simple tasks and they feel are very difficult, there are things we do on a daily basis. There are things we do on a minute-to-minute basis. So they need to work on that program at home. A couple times in the clinic is not necessarily going to get them fully recovered. All right, so what are we focusing on as rehab professionals? So physical therapy, just by nature of our degree, we tend to focus on those orthopedic injuries. A lot of times we'll assess the cervical spine. We may treat the vestibular and ocular motor deficits that are going along, especially if that therapist has some type of a neurological background. Those tests are going to become a little bit more easier for that type of therapist than maybe someone who does a lot more of the orthopedic type of injuries. But it's important to take a look at those. We need to make sure we understand balance assessments, what are basic, what are more involved, and that we're picking the right ones. And then we need to look at return to play, return to work considerations. What physical activities are involved in their daily basis or their job duties? We need to have an understanding of some sports conditioning exercises, how to progress them, and just how the body responds to physical activity. Occupational therapists, once again, a lot of times they're going to look a lot at that ocular motor assessment. The eyes are hugely important for daily functional tasks. They may look at things with memory and concentration, both in a quiet environment and in a busy environment. So think about where you work, where you go. Sometimes you may be the only person, and other times there may be a bunch of people around you. Patients need to be able to tolerate and perform these tasks in both types of settings. They may look at some functional vision activities, ability to look at a computer screen, ability to look at a piece of paper and look at something across the room. So for like a student that needs to look at a whiteboard or a smartboard and then take notes or look at their tablet, we need to go back and forth between near and far objects. They're going to look at some things for return to work and multitasking, how to get them back to doing those activities. All right, so that's a lot to take in. Where do you start? Well, first and foremost, look at who's on your team, where you're working. What are your strengths? You as a professional, your team strengths, and then look at where do you need maybe a little bit more professional growth. So, we highlighted a couple different areas that we need to look at from PT and OT. And if, you go, yeah, I do a lot of neurological rehab, but ooh, that sports conditioning part stuff is not something I do on a regular basis. Well, maybe we need to look at that, or vice versa. Identify the tools that your clinic needs. So once again, there's a lot of different balance assessments out there. There's things you can do with a block of foam. There's walking tests, functional movement tests, and we have baselines for those. There are more advanced tests that use computers. They use force plates. They have walls that are moving and or visual motion. Those are great to have. They cost a lot of money, but they're really nice. So you kind of have to identify, is that something that's in your budget or not? Ocular motor tools. Um, these can be very simple, a vision chart, some popsicle sticks with letters on them, maybe a pair of infrared goggles to look at eyes. But once again, there's also a lot of more specialized tools that can be utilized by both PTs and OTs that cost money. Impact. Um, can be hugely helpful to get a baseline on these patients. Have them sit and take the test and see where they score. If it's an athlete, you can compare to where they were pre-season and see what things have dropped. You can use it to make decisions on what areas you need to address. And then going forward, completing an impact on them again and looking at where have they changed and what types of things are still giving them difficulties. It's also kind of important to review international recommendations for recovery and care, things like Berlin or Zurich concussion conferences that give you kind of like that baseline. Here's the consensus of how we treat patients, but then also look at state guidelines for released activity. As we talked about in the beginning, there's safe youth and sports acts and different things like that. That may vary a little bit by state. Of course, your practice act, depending where you practice, PT, OT, speech, they vary state to state. So make sure you're working within what your state guidelines are. And then, as we've been saying all along, coordinate some type of method to communicate in a timely manner with the referring clinicians. especially in cases with return to play where someone wants to go back to sports. You want to make sure that you have the ability to get these players back on the field and make sure they're safe, but do it in a timely manner. And then important is to continue to improve. Um, Professional growth is huge, no matter where you're practicing. Be mindful of new research and recommendations. There's new things coming out all the time that can improve care or return to activity. Um, Monitor recovery and look for patterns among your patients. If you notice that your patients seem to be having difficulty in a certain area across the board, look at your program and what you're doing. Do we need to tweak something? Do we need to get another professional involved? Is there something that we can do better? And always communication, communication, communication. I feel like a broken record. No matter where you work, communication is one of those things that probably can always be improved. The more communication you have with the team providing care to the patient, the better that care the patient is going to get and the better their experience. And patient experience is huge. Um, if they trust you and they have faith in you, that's going to go a long way into helping with their recovery. Um, and then maybe look at establishing some tracks for care. So not just identify the roles of everyone, but identify, if a patient comes in with certain symptoms, we need to do test A, B, C. If they pass a certain test, what do we do next? Some algorithms or plans that you can sort of, you know, chunk patients into. Not saying that's going to be exactly what you do with them, but at least steer your team, especially as your team grows, um, into patterns that you think work for your clinic so that everyone's sort of working together and treating the patient the same. So,
Thank you, Nate. We have a few minutes left for Q&A. Our first question, are rehab professionals involved in setting academic accommodations for students during return to learn? And if so, to what extent?
all right. So that's a little bit of a loaded question. Certainly, as rehab professionals, we can make recommendations for academic accommodations and what we feel is going to work the best for them. Now, depending on the state you're in, how those things are utilized can vary a little bit. So, example for where I practice, um, our referring clinicians a lot of times will give some safety recommendations for things like, the student can't return to gym class, or please make sure they're carrying water to stay hydrated, or please allow them to leave the classroom early so they're not in a hallway with a lot of other students because they are off balance and they need someone to walk with them carefully. Those things usually can be followed. Um, Now, in addition to that, the OTs I work with, along with our referring providers, a lot of times will give some recommendations for those academic accommodations. And those are more recommendations. The schools, the teachers ultimately, at least where I practice, um, have the ability to say, yes, we want to follow that, or no, because they're the experts in the recovery to learn. Um, what we have found out, though, is a lot of the schools do appreciate when you can share some of that information. Now, once again, make sure you're following HIPAA and things like that, and you have proper signed consents. But it does go a long way, because if you're seeing things in the clinic and you go, oh, that relates to an issue they're having in school, it allows the schools to really just help those kids get better. Um, so, like I said, yes and no.
All right, thank you, Nate. And our second question, are home exercise programs created on a patient by patient basis? And will they evolve as the patient's symptoms change throughout recovery?
Yes, they're definitely created on a patient-to-patient basis. Now, just because of the nature of the injury, a lot of times there are some very similar exercises that you're going to provide the patient, um, especially in the beginning. Some common things that we give out a lot to our patients are some ocular motor exercises, some vestibular exercises. Sometimes OT will give out some basic cognitive exercises. Um, but as the patient progresses, or depending on the level of kind of disability or functional status they come in at, those programs have a lot of variation to them. especially as we start getting to feeling better and higher level recovery. Um, that's where you can a lot of times start pulling in even some sports specific things. So if you have a soccer player versus a baseball player, um, totally different sport. They may do some similar conditioning things, but if you start thinking of like their balance and what they need to do and their ocular motor movements, um, you can start tying some sports specific activities in with it. So I would say yes, it's patient specific and it always evolves.
Great, thank you. And our last question, how can rehab professionals use impact to track patients' progress from initial visit and throughout their recovery?
They can use it for basically a multitude of purposes. You know, if it's somebody that's an athlete, whether they're school age, college, or professional, a lot of times they will have a preseason impact prior to their injury. Um, it's kind of like a cheat sheet. So they come in, we see them, we give them an impact day one or day two in the clinic, and we can now compare scores. We know where they were before their injury. We can see where they are after their injury and use that information to sort of help, develop that plan of care. Um, it allows us to see where they're struggling. Um, as they progress, a lot of times we'll repeat that again and once again compare scores. If someone we think is ready to return to sport and they complete it and hey, that preseason looks comparable to what we're getting now, great. If we're still seeing issues, we know, ooh, maybe we aren't quite where we want to be. Um, Likewise, though, sometimes people don't have a quote unquote preseason test. They're not an athlete. They're in an auto accident. Still, you can use some baseline scores based on population norms and compare that to how a person tests that first or second visit in your clinic, and use that same information, even though it may not be as specific as someone who took a preseason, to help develop your plan of care. Um, our referring clinicians always want this completed prior to release to sports, so that they know, in fact, that a person has met their goals and that we are, moving towards full recovery.
Great. Thank you so much, Nate, for presenting with us today. And thank you all for attending this webinar.
Thank you.